Hi, I'm Dr. Keith Volstad.
And I'm Laura McLeod Volstad of Volstad Chiropractic and Integrated Wellness. We're located at 275 Tony Penna Drive, Suite 12, right here in Jupiter. And our telephone number is 746-4242. We'd like to welcome you to this week's edition of the Chiropractic Corner, a weekly show spotlighting the chiropractic profession and what doctors of chiropractic do to improve their patients' health. In this program, Dr. Volstad and I plan to cover topics that pertain to your health from a complementary and alternative medicine point of view. These topics will include spinal injury issues like neck pain, low back pain, bulging discs, pinched nerves, and sports injuries, lifestyle medicine, dietary and nutritional advice, nutraceuticals, and supplementation, just to name a few. We'd like to encourage you to email us about topics that you'd like to hear discussed on this program. You can do that by emailing us at imchiro1, the number 1, at gmail.com. That's M as in Mary, CHIRO, the number 1, at gmail.com. Today, we have a first for us here on the Chiropractic Corner. We've been talking about back pain and how it might impact your life and what chiropractic can do to help folks who have it. Today, we thought it'd be nice to let you hear a different voice, a patient of ours who's had back pain and has been helped by chiropractic. We thought it would be interesting to share with you, our listeners, a personal story of someone who's had chiropractic care for their back pain. So Dr. Volstad and I would like to welcome Nate Stubbs to the show, a Jupiterite who's been a chiropractic patient for many years. Welcome, Nate.
Thanks, Laura. I really appreciate you and Dr. Volstad having me here.
Oh, it's our pleasure, Nate. Thanks for coming and being with us this morning. Why don't you tell us a little bit about yourself, Nate, where you're from and what you're doing down here in the tropics?
Well, I'm an actor, improviser, waiter. A lot of hyphens there, I know. I'm kind of a jack of all trades. I'm originally from Utah. I moved to Florida when I was 18 and spent 3 years here, moved to New York, went around the whole country, Texas for a little bit. Now I've been back in Florida for 5.5, 6 years now.
Man, you're a tumbleweed, moving from here to there.
It was too cold in New York.
That's right. I need the warm weather. My blood's thinned.
I don't blame you for that. It is much, much nicer here, especially in the wintertime.
Nate, how long have you been a chiropractic patient? Tell us a little bit about your physical background here.
Well, I teach acting to kids in West Palm Beach for Actors Rep. Shameless plug time here. You can visit us at actorsrep.org. We're a not-for-profit theater company. We teach acting and improv to kids and adults. But I've been a chiropractic patient off and on for, I want to say, the last 6 or 7 years of my life. Definitely more on than off in the last 3 or 4 years as I become more aware of my body, its eventual breakdown or entropy, and what I can do to slow that down.
That must be a very physical job for you to be such a young guy in here with some issues.
Yeah, and I don't feel that super young, to be honest with you.
Coming from where we're sitting, you're just a puppy.
Yes, that's very, very true. And I guess that improv that you do can be kind of taxing on your back and can create some problems for you, if I remember correctly.
It is. It's super physical, and you have to be ready to do whatever you're called upon to do at any moment. But you also have to make spot decisions about what you can and cannot do. And that's been my issue, is trying to do everything rather than realizing what my limits are and performing to my limits.
You know, I'm very much aware of that, as you and I have had discussions in our visits at the office in the past about talking about, I should say, what you can do, what you can't do, where you've explained to me why your back is hurting, and you've mentioned about a specific act or movement that you did during your improv show, and how that created some problems for you. And we've discussed about how, well, maybe you're not such a young man anymore, and you need to really be careful about what you do.
That's right on the money, Dr. Volstad. Actually, that is the biggest difference between you and any other chiropractor I've seen. Is it's been damage control with anyone else I've seen. It's, you're hurt. What can I do to fix this problem right now? Right. And then I'll see you the next time you're hurt. we really looked at what I was doing every day in my day-to-day life. Not just improvising, which is a lot, but waiting tables.
Right. Waiting the tables, that's right.
Ooh.
Is huge. I load up one side of my body and walk around, things like that. And really, we had a proactive discussion about being aware of my body and being aware of what I can and can't do, whether or not it hurts.
Wow, that's another really physical job, being the wait staff at restaurants. I don't know how people do that. I never had to do that. I don't have the physical strength for it. How do you load up those arms and get it all out there? Wow,
Being
you're
on
my
your feet
hero.
all day and carrying those trays around, especially with them hiked up a little bit, man, that's got to be tough. But I just wanted to interject real quick as well. I know Laura and I have been to one of your improv shows down in West
Yeah.
Palm, and it was really, really funny, and we really enjoyed that. And we're going to have to make an effort to try and get back to
Yeah,
another
that was a
one.
fun
So,
night.
You know, even though it's hurting your back, I want you to know it's for a good cause.
Yeah, we
because
appreciated it.
really was a good time. Really great entertainment.
Oh, thanks. I really appreciate that.
And Nate, with those two very physical jobs that you're doing there, what's been the issue for you that's brought you into our office? What's happened to kick you in the door?
Well, I have a herniated disc, and I've been diagnosed in the past with a twisted SI, which
Ouch.
scalia inferior. You have to help me, Dr.
Yeah,
Wilson.
sacroiliac joint. SI stands for sacroiliac joint.
What he said. So the real issue for me is bending and twisting and lifting while I'm doing it, especially, and actually just lifting in general. I the job where I work, wait tables. I don't fill up the ice buckets all the way. I fill them about halfway up when I go to fill up ice, which has just been a small change. You think it's
Yeah.
silly, but
No, that lifting can really be a problem for your back.
yeah, and I never bend over anymore. I get down on my knees if I have to pick something up off the ground, and that's a huge change just
Right.
in lifestyle.
Right.
One thing that happened to me in early January is I went from this chronic kind of lower back pain to I had an accident.
Oh boy, we've talked about accidents on our show, and you had a little fender bender a while ago. That's right. Was that January, February?
Absolutely, mid-January, I want to say, and it didn't seem like a big deal to me at the time. I was rear-ended. I got out. I
that's
talked
right.
to the gentleman behind me. It was a rainy road, and he just tried to stop and couldn't stop in time.
Yeah.
It bashed in his headlight, but it didn't really do any damage to my car.
Right.
And I was a little shaken, but I walked around. I felt okay, and I sent him on his merry way. I said, "Have a good day."
Oh boy, and no big deal, no pain for a few days, and then Kat, your lovely bride, kicked you into the office for care. So what made you hesitate? Why did she think you needed to come in and you didn't?
Well, I did come in immediately after my bureaucracy. I was afraid to make a claim, to call anyone, to call the cops, to do any of the normal bureaucratic things you do when you're in an accident.
Because you didn't have any damage to your car, no big deal.
Exactly. And so what ended up happening is I was in pain and I was trying to just man it out, just put up with it, and hopefully it would go away.
Did you think it was your usual chronic pain that you've always had? Or did it feel
Absolutely.
different?
It was more, but
More.
I didn't recognize it as coming straight off the accident until I'd had a couple visits in a row and was getting no relief.
I remember that because I know that first visit after your accident when you mentioned it to me. We talked about that and how I thought, you needed to kind of investigate that, and the decision was made to just kind of see how things went. So we've got to thank your bride, Kat, for getting you going on that regard, because I think it was a real blessing for you.
Absolutely. What I ended up doing is what you recommended doing the first time I saw you after the accident. I
Right.
kind of hemmed and hawed, dragged my feet, and spent 3 weeks in a lot of pain before my wife said, "Get your butt into the office." And actually what happened is she came in with me. And
that's
she
right.
sat in with
Yes,
the appointment.
she did.
That's right.
And rather than have a conversation through me with
right.
you, she had a direct
I
conversation
do
with
remember
you.
that.
Sometimes
Absolutely.
those wives just have to do what they have to do.
That's right.
And I went home and I bit the bullet and I called up my own insurance company and made a claim on my PIP, which is exactly why it's there.
That's what you pay for every month.
And that's really what was stopping me.
Was
Yes.
that hard to do? Was that a big deal when you called your insurance company? Did
No.
they say? Yeah.
No, not at all. It was a big deal in my mind. It was
Right.
not, in actuality, difficult at all.
It's interesting to note that despite our complaints about insurance companies, very commonly when you have a claim, they are very helpful and very willing to do what they need to do to see to it that you get things taken care of that need to be taken care of. So, insurance companies always get a bum rap, but there are a lot of times when they really do come through in the pinch.
And that's ended up being exactly what happened. I took 6 weeks off of everything. I did not
Wow.
work. My wife supported me, and I saw you 3 days a week to fix the slip disc that I had suffered in the car accident.
Your wife supported you? Man, that's awesome.
Don't get any ideas.
The one beautiful thing about my wife is she's always supportive no matter what I'm doing.
She's a wonderful, wonderful woman.
Especially in this case, she literally financially supported me. Another thing that I wouldn't have been able to do on my own is see a physician, get an MRI, and get the EMC.
Yep.
You really hooked me up in that way. I don't know if hooked up is the right phrasing, but
In today's world, that's fine.
gave me a reference at least to another physician.
You know what? We got to stop there too, because I always interrupt him when he uses those big words and those acronyms. Nate, what's an EMC? Why do you need that?
The EMC is an emergency
There you
medical
go.
certification, and it has to be written for the insurance company so that you can get full benefit of your PIP. That is the $10,000 full benefit, and it has to be done by a medical doctor.
Right, that you pay for every month. You pay for that $10,000
Right.
benefit in your insurance. But if you don't get an EMC, an emergency medical condition, then what happens, Doc?
Then you only get a portion of your PIP up
A
to
quarter of it.
$2,500.
That's right, and that's the bureaucratic part
And they
I
don't
was
tell you
talking
that.
about, and
Right.
that
Exactly.
seemed really hard for me to do. And you really led me in the direction so I could do that.
Well, I'm
easily.
very happy we were able to help with that.
Each-
Okay, moving on a little bit here. Nate, why don't you take a few minutes, if you would, please, and for the benefit of our listeners, talk a little bit about the treatment protocol that you received at the office for the auto accident, and maybe tie that into the treatment that you had been receiving prior to the accident, if there were any changes in your mind or any differences in your mind about the treatment protocol that you received, so that maybe patients can have some fears allayed that getting a treatment and getting care for injuries like that isn't such a terrible, terrible thing.
Well, I'll definitely tell you the treatment is enjoyable. I've joked with Laura before about having stim parties or electricity parties. For those of you who aren't familiar, before I get adjusted, I spend 10 minutes to 30 minutes on a bed with a heated blanket and electrodes connected to my back. And it's like getting a massage.
Is that the snoring that I hear?
Yeah, that's the snoring.
We always ask Nate, all right, how much time do you have? Do you want me to start the clock today or you want a nap? You know?
So the idea of it being scary is a little foreign to me, but I understand that because the idea of making a claim was scary to me until I did it.
Right.
As far as treatment protocols, I will tell you the biggest change in my life, and maybe I said this before, is my behavior. Once I had my accident, we sat down and talked about what I did in my day-to-day life and what I had to do in my day-to-day life and what I could not do anymore in my day-to-day life. And that's been a huge change. Also, up to that point, I had never participated in or been given instruction in physical therapy, in how to strengthen my core to really prevent the further slippage of the injury, to stop pain from reoccurring in the future. You gave me some exercises to do. We talked about my diet, what I was eating, natural supplements for anti-inflammatories. Smoking was a giant thing that you brought up.
Yes.
The body's reaction to nicotine, to the smoke, is to inflame, to swell up.
Oh, yes. It's a huge problem that people don't really understand because it's not something that you really notice. It's a long-term effect, and subsequently the cancers, et cetera, that arise 10, 15, 20, 30 years down the road. So
More
we don't
than
want to lose
anything, nobody really talks about that. Nobody talks about the inflammation that smoking can cause in your body and how damaging that could be.
Oh, that's
We've never heard that.
That is huge.
I was going to say, yeah, I knew smoking was bad for me. I'm
Right.
not a fool. Everyone knows smoking is bad. I did not realize smoking affected and caused my back pain. That was huge.
It can certainly affect the back pain because of the inflammatory response that your body goes through with, as a result of, I should say, of the smoking. And you're already inflamed because of the injury, and now you smoke on top of that, and it just adds to the inflammatory
Exacerbates it,
process and exacerbates the pain. That's a great word, and makes things worse for you. So yeah, you're right. I hope you take that to heart.
Yep, absolutely. Another thing I got at your office, I make smoothies every day for my lunch or breakfast, depending on when I actually eat it.
Mm-hmm.
So I got some like vegetable powder, and things like that are available all over. When I buy them at your office, I know exactly what I'm getting. I'm getting the product I want to buy instead of hopefully the product I want to buy.
Yeah, that's kind of an interesting point that you make right there, because there was some interesting articles, I think it was in the New York Times here recently, about the New York Attorney General coming out and commenting about how a lot of the nutraceuticals, the vitamins, supplements, etc., that were tested from Walmart or CVS, etc., didn't have in them what was claimed to be in them on the bottle.
Right.
So you do really have to be careful what you buy, and buying it from a health professional is probably the smartest way to go, because you know that there's a reputation on the line relative to the things that they're selling, and they're not going to just sell you junk.
Absolutely. That is, I will say one thing I really love about your office is you don't rest on your laurels. You're not sitting around going, well, we're doing a good job, let's keep doing it. You're always looking for ways to improve. I have lower lumbar support cushions, which is probably in every chiropractic office, but I bought them from you, not for you.
We have one.
I've lost a few of them. I've bought more. I've bought the supplements. I like the fact you're always looking for the next thing in technology, in nutrition, in everything. The Magnosphere in your office is pretty cool.
Right.
Took a ride on that.
What is it? It's a roller coaster.
Yeah, exactly.
Yeah, there's a show just on that coming up soon. We haven't talked a whole lot about that yet, but yeah, that's a wonderful device.
But I really love that you're not like, well, I know what I'm doing, time to do it. It's I know what I'm doing, and how can I get better at it? What can I learn more about?
Well, I really appreciate that, because that is important. You kind of have to stay on the cutting edge, because there's new things coming out all the time, especially in the area of wellness care, natural care, what I like to term functional medicine. There's just so much coming out nowadays on the utilization of natural substances and products for the resolution of health issues. I think patients are becoming more and more aware that these options are available. They don't always have to turn to a prescription or medication as the first step in trying to get their health issue resolved. So it's incumbent upon me to try and stay ahead of the curve in regards to these types of therapies and treatments, so that when patients want to talk about them, I'm educated and able to advise them in an appropriate manner. Okay, listeners, just to let you know, we are going to talk a lot more about functional medicine in the future. We will actually have several shows covering some of the ideas and principles of functional medicine. Okay, Nate, what I'd like to ask you now is relative to the fact that I'm kind of the new guy on the block. I've only been in that office a little bit over a year and a half, and as we transitioned from the previous doctor to the new doctor, I'd like you to kind of explain to us a little bit about that process from your perspective as a patient, because I know it's difficult when you've been with a doctor for many years and you really like him and he's a good doctor, and now all of a sudden you're confronted with another physician whom you don't know, whom you're not sure what his abilities are, what his personality is, are we going to get along? And very commonly, if there's going to be an exodus from the office, that's a time when that may occur. So for the sake of our listeners, would you just give us a brief understanding of how that worked for you and why you, in fact, decided to stay with the office.
Sure. I had been seeing the chiropractor that was in the office previous to you. I was introduced to him through my mother-in-law. Back when the Burt Reynolds Institute for Theater Training was around, he treated them, and that's how I was introduced to him. A big thing, I did think about moving because I live in West Palm Beach now. I've lived in Jupiter in the past when it was much closer to me, but it's about a half-hour drive for me to come see you, so it's not the closest, most convenient chiropractor,
Right.
for me at least. A big part of that transition for me was, I'm sorry to say this to you, but it was your wife.
Well, hey, I don't have a problem with that. I think she's wonderful as well.
Laura's been working in the office.
You beach Thomas?
I think previously to you, for a little while, and I developed a relationship with her. A very platonic relationship, I assure you. But I trusted her. She always had my best interests at heart. She seemed very concerned, always, every time I visited, with my comfortability, how I was doing, what was going on in my life, my personal life, things that had nothing to do with my injury. So when you came in and she spoke highly of you, I was like, okay, let's give him a shot. And I think I'd been seeing you a couple of months before she let slip or said something, not let slip, but said something that referred to you as her husband. And to me, that was a cinch. That was like, snap. Oh, they're married? Okay. Well, everything's fine then.
Okay. Interesting.
That really is. I trusted your wife 100%. And then through association, I guess, I passed on that trust to you. And then that's been proved right since. Like, I will say a huge impact on me. I want to say 9 months to a year ago, my parents were visiting here from Utah.
Oh,
I remember
right.
that. Yes.
They visit pretty much twice a year or so. But my dad's, both my parents see a chiropractor regularly in Utah. My dad's in poor health and suffers from a couple of different things, but he took a tumble getting off the trolley in downtown West Palm and really, really hurt his knee. And the fact that, I don't know, the way in which you took care of him, and I watched that the same way probably my wife watched the way you took care of me, really impacted what I thought of you. You just took care of him the way I wanted somebody to take care of my dad. I don't know how to put it any more than that. Like, that solidified the relationship to me.
Well, I certainly appreciate that, and that's a wonderful story, and I'm glad we were able to help your dad.
He's a sweet man.
That's interesting to note that how the transition occurred for you, and that in fact it wasn't so much the doctor that solidified things for you, but that it was in this case the staff, who happened to be my wife. But the staff is the interesting connection that allowed you then, or prompted you, I should say, to continue your care at our office when, as you correctly stated, you do live a little bit of a distance away, and it would have been just so easy to say, look, it's a lot more convenient for me to find somebody who's, a mile away versus someone who's maybe 10 or 12 miles away. So I do appreciate that, and I certainly do appreciate your confidence in us, and I hope that we're able to continue to earn that trust and respect from you, as we try to do with all our patients, by the way.
Yep, and I certainly appreciate that, Nate. He always makes me laugh. Thank you for that. We always have a good laugh every time Nate comes in.
It's true. We tell stories about the doc.
Wait a minute. All right,
but it's fun. We treat we like to think we do anyway, but we feel like our patients are our extended family. We treat them like we would our own, and that's very important to us. So we can't do it any other way. So that's just who we are.
Let me just say that idea, that trust that is put out there, that has been returned and proven to me like tenfold. Just so you both know that I have been taken care of here differently than I have been taken care of anywhere else. And that is because you've bought into my life, and it's important to you that what's going on in my life is working well. Like, that's literally, I'm not a number, I'm a person. I feel like you care about me, and that's why I get the service I get.
That's awesome, Nate. Thank you. And it is important.
Thanks.
With the recovery of health, there are three aspects to health: the spiritual, the physical, and the emotional. And we certainly do try to cover all the bases in regards to that with all of our patients. Well, Nate, thanks so much for stopping by. I really have enjoyed our conversation with you here on the Chiropractic Corner, and I'm sure I'll be seeing you here again very shortly at the office.
Oh, yeah.
Yeah, thank you, Nate, for joining us today. It's been a lot of fun. We've got to do this again.
And now time for the tip of the week. We have a few hiccup remedies for you to consider right from your own kitchen and coming to us from the People's Pharmacy. There are several sour alternatives. Try popping an olive in your mouth, or take a few sips of dill pickle juice, or take a tablespoon of apple cider vinegar. There are also some sweet alternatives you may prefer. Pop a few chocolate chips in your mouth. That seems to trigger an interruption of the hiccup reflex. Another conventional and well-known remedy with some science behind it is to take a spoonful of dry sugar. Research has shown sugar irritates the phrenic nerve located at the top of the palate, and that can interrupt the hiccup reflex. But this is the only time I would ever recommend that, as sugar can cause inflammation in the body. So, choose a sour or sweet method to try the next time you or yours have a persistent case of hiccups. Hiccup!
Good one, Doc. Well, that about wraps it up for another edition of the Chiropractic Corner. Again, thank you for joining us and for all of your input. Dr. Volstad and I would like to thank you for listening, and don't forget to let us know what questions you may have for Doc or topics you'd like to learn more about by emailing us at M as in Mary, CHIRO, the number 1, at gmail.com, or by calling our office at 746-4242. We're located at 275 Tony Penna Drive, Suite 12, right here in Jupiter. We'd love to hear from you. Google Volstad Chiropractic to find our website for more information about our office or to listen to archived programs from the Chiropractic Corner. And coming soon, our show bloopers. For those on Facebook, please search and find our Facebook page and give us a like. We post a lot of information about healthcare and natural remedies that you can use at home. Join us next weekend for another edition of the Chiropractic Corner, right here on WJUP, The Jupe, 103.9 FM, Saturday and Sunday mornings right after the 10:30 a.m. news. Until then, be well, live well. We'll see you next week.